Hi class, my name is Katie and today I'm going to be talking about a UCL sprain for my injury assignment. So the UCL stands for your ulnar collateral ligament and it is located on the medial side of your elbow. So in anatomical position, that's going to be this ulnar side right here. And a ligament is made up of fibrous tissues and connects bone to bone. And a ligament's main function is to stabilize structures. So when a ligament happens to be torn or sprained, this causes an instability, and for the UCL, that would cause an instability in the elbow. So, like I mentioned, an injury to the UCL occurs when one of the ligaments in the elbow tears, and this is a very common injury in overhead throwing athletes, such as baseball players, javelin throwers, even volleyball players. And so this injury will frequently occur during those seasons, but particularly baseball. It's very common in baseball pitchers. So for baseball specifically, factors that would affect this injury include your throwing velocity and speed, how often you're pitching, if you're getting an adequate rest period in between games, if you're pitching fatigued, or if you're trying to pitch new pitches. These can all affect the strain that is put on your UCL and can cause it to sprain or tear, which is not good. So the UCL is made up of 3 bands. It attaches at the ulna and humerus, and there is an anterior band, a posterior band, and a transverse band as pictured here. And the anterior band plays the largest role in providing the stability for the elbow. So some signs and symptoms that you may have suffered a UCL sprain include inability to grip objects, inability to straighten the elbow, numbness and tingling in the fingers and hand, pain and tenderness of the medial elbow, and swelling and bruising of the medial elbow and forearm. So to diagnose this injury, you will need a medical professional to be consulted, and typically they will perform a history on the athlete, asking them a bunch of different questions. They're going to do different stress and special tests to narrow down what the injury could be and what the injury could not be. And they may even want to take an X-ray or an MRI to rule out any fractures or other injuries. So as we've talked about in class, there are different grades of sprains and they're graded by severity. So the higher the number, the more severe that sprain is going to be. So there are 3 degrees, and the first degree is just going to be the stretching of that ligament. Second degree sprain is going to be a partial tear of the ligament, and third degree sprain is going to be a full tear of the ligament that will require surgery to repair it. So like I mentioned earlier, the most common mechanism of injury is this overhead throwing motion that baseball players, javelin throwers, volleyball players will do, any kind of valgus force like that. And that is the reason why it's very common in baseball pitchers. And this can be an acute injury that happens all of a sudden. You make a pitch and you feel that pop, or it can be chronic and that UCL can deteriorate over time. And like I just mentioned, most times when that UCL tears or strains, you will feel that pop. So when the UCL is first sprained or torn, the body will respond with inflammation. That's where you get that redness, that bruising, that swelling that occurs in the elbow. Your body starts that inflammatory process that gives you that signal, hey, I think something's wrong here. We need to get some attention to this. This is causing pain. We need to slow down. So a lot in class this semester, we've talked about the HOPS process. So I just wanted to go through, if I were an athletic trainer with a potential UCL sprain, what I would go through and what I would think about. So during the history, some of the questions I would want to ask would be, what were you doing when the injury took place? Was it all at once, or did it happen over time? So was it acute or chronic? Did you feel that pop? What does this pain feel like? Is it more of a dull pain or a sharp stabbing pain? Where exactly is the pain the worst? Have you noticed any weakness or instability in the elbow, any numbness or tingling, and any prior history of elbow injury or previous surgery? And then in that observation stage, definitely wanting to look at the mobility that the elbow has, looking for that swelling, discoloration, and bruising that you would get on the medial elbow. Then moving into the palpation stage, you're going to locate where that point tenderness is. You're going to palpate those bony areas. Make sure to palpate above and below where you think the site of injury is. Compare bilaterally and note any crepitus that is in the elbow. And then finally, for the stress and special tests, that valgus stress test is going to be really important to assess the stability of the elbow. You're going to want to look at that range of motion and perform some manual muscle tests. So going into the stages of healing, to treat this injury, to treat a UCL sprain, athletes need to rest. Immediately, if you feel that you have a UCL sprain, if you've been diagnosed with a UCL sprain, you will not be going back into the game. You need to stop that physical activity that the injured arm is doing and allow it that proper time to heal. You're going to need to use ice to reduce the pain and swelling. You may need to use some pain medication to aid in that pain relief. And it is also possible that you will need physical therapy to start regaining that full mobility and strength of the elbow and using the peace and love principles. So in the most extreme cases, you will need a surgery, and this is commonly known as the Tommy John surgery, and it's the reconstruction of the UCL. So I have this picture here that kind of shows a little bit about the process of the UCL tear. They go in and drill holes in the ulna and humerus, and they'll take a tendon from a different part of the body and kind of string it through, trying to regain that stability that the UCL provides. And this surgery is named after Tommy John, who was the first baseball player to go through this surgery. So if you just have that first-degree sprain or that second-degree sprain, then it's probably going to take you anywhere from a few weeks to a few months to recover, depending on the severity. But if you do need the Tommy John surgery, then it is going to take anywhere from 9 months to a year to regain that full elbow use and to really get back to normal. This picture right here kind of shows you just how serious that sprain and tear can be and how painful it really looks. You can see how it's definitely been strained and torn right there. And that's a really important part of the elbow to really keep it stable. So without that, it has to be corrected. And so really, to go about diagnosing this injury, you're going to be diagnosed by a medical professional, and then they're going to need to determine the severity of the injury, whether they need to go in a surgical route or whether it's just going to be a rest period with that ice, with that brace to prevent that movement for a while. And so, like I mentioned, a brace is probably going to need to be worn for months. Rehab could possibly need to be done. Definitely rehab if you have to have that Tommy John surgery. This is an example of one of those braces might look like following surgery. It's very heavy duty. This injury is really no joke. It is very serious and very common. and causes athletes a lot of pain. So that area does have to be immobilized until that strength can be regained. And as mentioned before, definitely using that ice to lessen some pain and swelling, and just gradually working your way back into that activity is really important. You definitely don't want to go and just throw yourself back into that activity, because that could cause you to re-injure your UCL. So thank you guys for listening.